For more on the humanitarian situation in Yemen, I'm joined from Sana'a by Shabia Mantoo. She's the UNHCR spokesperson for Yemen. Shabia, thank you for joining us. Can you describe to us the severity of the situation in Yemen as of today?
Well, Yemen's facing the world's largest humanitarian crisis. We have about 20 million people in need of humanitarian assistance. There's a conflict that's raging on. There are about 2 million people who've been uprooted from their homes and languishing in desperate conditions across Yemen. There are about 17 million people who don't have enough food to eat in the country. So Yemen's also facing the world's largest food security emergency as well. And on top of that, we're seeing an unprecedented cholera outbreak, making it the world's worst, with 500,000 people suspected of having cholera and almost 2,000 deaths just as a result of cholera, suspected cholera alone. So the condition here on the ground is abysmal. Humanitarian needs are increasing day by day, and we're seeing many more consequences of the conflict that are manifesting themselves and resulting in unnecessary human suffering.
Shabia, is the international community doing enough to address the needs of the Yemeni people?
Well, the international community has responded to the humanitarian situation in Yemen, but we are really facing shortfalls in the ability to respond without enough support. So if we look at our operations here on the ground, we're responding to mass displacement across the country, trying to provide critical items for people who have had to flee their homes because of violence. And we're less than half funded to date, and we're already approaching the end of the year. So there has been a response, but it's not enough. We definitely do need more, and we need more urgently to be able to respond immediately here on the ground all across Yemen.
A cholera epidemic is one of the crises people are facing. What about other issues that haven't been resolved, Shabia?
Well, it's the world's largest, but it's also, we're seeing as a result of conflict, there are a lot of man-made consequences. So cholera itself, it's a direct consequence of the conflict. It's also resulting because there just aren't enough health facilities that are functioning in Yemen. Cholera is a very easily treatable disease, and unfortunately with less than half of Yemen's health facilities capacitated and functioning, it's very difficult for people to access healthcare, water, sanitation as well. These are issues that need to be addressed. We've seen because of the conflict that people who are working as state employees have not received their salaries. So there are shortfalls in being able to provide essential state services. So for us humanitarians, our response is predicated on at least a minimum of state functionality. But we're seeing these essential institutions that are on the verge of collapse, things like health, water and sanitation, as I mentioned. So these are all contributing to the symptoms of what we're seeing today. So cholera is one of them. We're seeing mass displacement, again another consequence of the conflict. And we're seeing food insecurity, where so many people are without adequate food, again because of the crisis.
And Shabia, what about the state of the health facilities? Reports suggest a majority of the hospitals and clinics in Yemen have been destroyed. What are you seeing on the ground?
Well, we're seeing that essential state institutions such as the health sector are facing huge challenges. Less than half of health facilities are functioning, as I mentioned. So we are seeing that there are shortages of medicines. It's very difficult for people to access healthcare, and there also aren't enough medical staff being in place as well to be able to respond to these needs. So, I mean, we're looking at 500,000 suspected cholera cases. This is a huge number, and it's in addition to other conflict-induced casualties as well. We have to remember that there's an active war raging on, where about an average of 75 people are said to be killed or injured every day. So it is overwhelmed. Public institutions are really overwhelmed in Yemen. They're trying to operate in the context of a war zone.
Shabia Mantoo, UNHCR spokesperson from Yemen, thank you for joining us from Sana'a in Yemen.